Do you want a stronger and more stable core? Do you also want to decrease the risk of overloading your lower back? Or do you want to increase your overall strength so you can hit more PR lifts? In this video, I'm going to share with you the simplest way to build a stronger core in minutes, and it's by teaching you how to activate and use this one muscle appropriately. First, we must define the core and how it functions for stability. Now, when I say core, what's the first thing that comes to mind? Did you think of your ab muscles like your rectus abdominis? Unfortunately, that's what most people think. Now, your abs are a part of your core, but they're only one piece of the puzzle. So let's understand all the pieces so you know how to feel stronger in minutes. I want you to think of your core as a cylinder similar to this pop can here, where first in the front, you have your rectus abdominis or your vanity muscles, but also in the back here, you have your spinal stabilizers such as your erectors and multifidi. You have your pelvic floor musculature here on the bottom. You have everybody's favorite, your transverse abdominis, aka the surrounding walls of the cylinder. And lastly, you have the muscle that everybody overlooks on the top, and that being your diaphragm. Now, why is the diaphragm so important? Well, first, it keeps us alive through respiration because we have to breathe. But secondarily, it increases our core strength and stability through generating intra-abdominal pressure, or otherwise known as IAP. Think of your diaphragm as a piston. When it's relaxed, it's more dome-shaped. We have less pressure in the abdomen. But as you breathe in, that muscle flattens, and in turn, it increases and generates intra-abdominal pressure. And that pressure goes out in all directions, stiffening and stabilizing our spine. That is why you see a lot of strongmen and power lifters breathing in and then bracing before going for a heavy lift. So how do we start activating more of our diaphragm to increase both our strength and stability? Well, the short answer is proper breathing mechanics. I'm going to show you a sequence of exercises that if you master these concepts, you could translate this to any lift or exercise to increase your strength. So first we need to master our breathing. So we're going to lie on our backs, and we're going to get into a hook lying position where we just bend both knees, bringing heels towards our butt. And then from here, we're going to place one hand on our heart, one hand on our belly button, and we're just going to simply breathe. Now you're going to give me 3 or 4 breaths, and I just want you to note where you feel that movement. Do you feel that movement more in your hand up top, hand on the bottom, or do you feel a nice equal distribution between both of them? Now, if you're feeling way more of that movement up top, then know you have a pathological breathing pattern where you're getting more of that chest breath, and that tells us that diaphragm isn't descending and we're not taking advantage of that intra-abdominal pressure. So to start activating more of the diaphragm, what you're gonna do is make little L's with your fingers. You're gonna squeeze your abdomen right around belly button level, and pushing in, now I want you to think of breathing in through your nose and then breathing into that hand pressure, trying to force it out. So it's a nice inhale in, and then let it out. And for some of you, if you've never done this before, it may take 5 to 10 breaths to start figuring this out. Nice inhale through the nose, out through the mouth. And what we're looking for is that movement to spread out in 360 degrees. Now, if you're having trouble and you can't feel your hands moving, a simple hack you can do is just grab a light weight. I got a kettlebell here, place it on your abdomen. Then you're gonna think about breathing that weight towards the ceiling. So as I breathe in, I'm thinking of allowing that breath to expand my abdomen. We're generating that intra-abdominal pressure. Weight should go up towards the ceiling, then we let it out. Weight should come back down, and then you would simply repeat for your 10 to 15 breaths. So there's level 1. Some of you might struggle a lot with this, so don't move on to level 2 that I'm about to show. You would just practice this daily, trying to breathe into the abdomen, again, getting that nice descension of the diaphragm, so then we get that outward pressure here. And once you can generate that intra-abdominal pressure, we can use it to our advantage when we translate this to lifts, which I'll show you in a few moves from now. So for the second move, we're gonna be in a similar starting position, but instead of this hook lying position, we're gonna come into what we call a 3-month supine. So what is that? Basically think of bringing knees towards chest, maybe knees just a little bit above belt line here, And then we're gonna make sure our back is nice and flat, because if we don't have that good alignment, then all that pressure is gonna go out the front. And if we have that nice stacked position, we'll get that nice spinal and core stability that we're looking for. So from here, we're gonna do the same thing where we make L's with our fingers, and then we're gonna squeeze into our abdomen, trying to breathe in, and then let it out. Breathe in, let it out. So with this move, we're trying to activate our core muscles because we have to be engaged or else our feet are gonna fall to the floor. Now we're generating that intra-abdominal pressure while our abs are more contracted, so you won't feel as much outward pressure here. But the combination of ab engagement with intra-abdominal pressure, again, is how you take that core stability and strength to the next level. So again, we're just gonna do a good 10 to 15 breaths. Breathing in, out. And then if you feel anything in your lower back during this, just stop. Just know you're cranking into your spine for support because you don't know how to control that nice diaphragmatic breathing pattern. And as mentioned during the first move, if you need to, you can use a weight where you push that weight towards the ceiling and then just try to breathe in, breathe out, really controlling that intra-abdominal pressure. So now our third and final move in this sequence, I'm gonna show you how to add some dynamic movement to it because, well, life is dynamic. So we're gonna get right back into that 3-month supine position where our knees are slightly above belt line, so we have that nice flat back. From here, we're gonna breathe in, generate that intra-abdominal pressure, we're gonna hold, and then we're just gonna tap one heel at a time. So now we're having to stabilize our core with good alignment, that good pressure here, and then we're having to dissociate our limbs or our legs in this instance while maintaining that pressure. Again, breathe in, good pressure, tap one heel, boom, bring it back, tap the other, boom, and then reset your breath. Now, if this is too easy, what you can do is generate that pressure and then kick your leg all the way straight. So now your limb is further from that base of stability, so you should shake a lot more while doing this, and then bring it back. And that's how we start incorporating that movement. Now this position might look familiar to a common core exercise, so then you can translate this into what we call a dead bug, where now we can start training some of the obliques and our abs with that intra-abdominal pressure so we can really enhance that core stability. So a dead bug position is hands and legs straight out in front. Again, we're gonna breathe, generate pressure, hold that, and we're gonna move opposite arm, opposite leg while keeping that good alignment and pressure at the same time. And then we could just simply do this for a good 10 to 15 reps. This one should be harder than the heel taps, especially if you want to straighten that leg all the way out at the same time. So there's a simple sequence you can do, generating more of that intra-abdominal pressure, stabilizing the core more, and we can start adding dynamic movement to it. And lastly, I'm going to show you how these principles come together in a compound movement such as a deadlift. So now that I taught you how to generate more of that intra-abdominal pressure using our diaphragm, we're going to incorporate that into a dynamic movement or a compound movement. And this is where your strength gains can go to the next level. So I'm just going to perform a simple kettlebell deadlift. So step number one is we want to think of the core ABCs. The first thing is alignment, because to be able to generate equal pressure throughout, you need to have that rib cage parallel to your pelvis here, aka diaphragm stacked over the pelvic floor. So what we're going to do is hinge back, again maintaining that alignment. Then we're going to breathe in, similar to what we did with holding our sides during the first movements. Breathe in, hold that position, then we're going to grab the weight and then simply perform the movement. With a deadlift, you can reset at the top if you need to, since you have good alignment. Breathe in, hold, set that weight back down. And using this proper breathing and activation, you're gonna feel a lot stronger, and some of you will be able to increase your PR lifts right away. To recap, think of your core as a pop can or a cylinder. Again, we have our abs in the front, our spinal muscles in the back. We have our transverse abdominis going all the way around and connecting to those muscles. You have your pelvic floor on the bottom here, and again, you have that diaphragm. So if we can really get that diaphragm to collapse, it's gonna increase that pressure and you're gonna feel a lot stronger and more stable. If you're curious what your baseline strength is of your core, then check out this video to self-assess how strong your core is in minutes.